morning, everyone, and welcome to Daytime Tri-Cities. I'm Chris McIntosh. She is Amy Lynn, and we are live at Niswonger Children's Hospital here in Johnson City because today's the big day. We've been talking about it all week long. The Radiothon is well underway.
And we are so excited to be here. Already an incredible morning. Can't wait to share a lot of news with you.
Yes.
And of course, such a special day as we come together as a community to raise money for such an incredibly important place. Today, it is all about the children here in 4 states at the Niswonger Children's Hospital.
29 counties served by this one facility right here. So many children. Thousands of children over the years have been helped right here, get the health care that they need right here, and we're able to do it locally right here in our region, and that is such a blessing.
Yeah, we talk about what a blessing this place is to so many families here in our area, and we've heard those stories and got to meet those parents and just the people here. It's such an incredibly special place, and you feel it once you come in that front door.
It's so welcoming, but they have all the care, everything that we need to take care of the children's health right here in our region. And they made an announcement today that we're going to be talking about throughout the hour that has so many moving parts to it. It's going to take us the rest of the hour to kind of flesh everything out that's going to be happening in the near future right here in Niswonger.
And we heard words, Chris, this morning like historic. It was an emotional day as we talked about the investment into the future, into the children of our region, the establishment of the Niswonger Children's Network.
That's right.
And we're going to be talking about that throughout the hour as we raise money here for the Children's Hospital, and that's what it's all about today. You see, we've got the number right here.
All right, we got the number right there at the bottom of the screen. It is, and I'm going to remind everybody, 1-855-611-KIDS, and that is 5437. You can call that number all day long, or you can text KITE, the word KITE, to 243-725 all day long and make a donation. And we were talking about investment. I cannot think of anything that we can invest in more than the children of our region.
Yeah, absolutely. And that's what we're going to be doing over the next couple of days here. It's something you and I look forward to every year as we get to see some familiar faces. We talked about it kind of being a reunion this morning. Lots and lots of people here to make some big announcements that we're going to be sharing with you.
Well, let's welcome one of those people in right now. Dr. Patricia Chambers, come on in here real quick.
Good morning. Good morning. It's great to have you with us. What an incredible day here. The Niswonger Radiothon that we talk about, bringing money. You get to see these families and meet these people. What is it like for you to be part as a medical officer here?
Yeah, so as the Chief Medical Officer, this is a big day. This is my first time experiencing Radiothon, and I am so excited. You could feel it up on the floors as we sort of started revealing things to the staff about the investments that are being made and the exciting new changes, because it is all about taking the very best care of the children entrusted to us.
And you see that. We're talking about making investment in children. It truly is an investment in our future, isn't it?
Oh, absolutely. You know, we went to our neonatal unit this morning to spread the word to the nurses, and we could see those babies, and some of them are so tiny and so vulnerable, but you can feel not just the nurses' support, but the community support. Little hats, little blankets, things that have been donated, things where this community pulls together to try to give to these kids. And Radiothon is really just another example of how incredible this community is.
How important is it, that support that you're feeling really throughout the year from the families and the business leaders and the community really coming together to support such a special place?
Yes. So I would say this year has highlighted this for us as healthcare workers. Working in pediatrics is always one of those things that people say one of two things. I love working with kids, or I could never do what you do. Pediatric healthcare can be heartbreaking because you're seeing suffering in the smallest, most vulnerable people, and you just want to make it all better. But knowing that your community's behind you, knowing that your community's praying for you, knowing that the community really rallies with support for the patients and their families, but also for the healthcare workers, is enormous. And it gives you that strength every day to get up, come to work, and say, I am going to give the very best of what God has given me to these kids today.
And you're on the front line. You see the daily care that is given here. Talk to me about that interaction with those families. And it is, we were talking about this place being a blessing. It's a blessing to those families, isn't it?
Absolutely. As an emergency medicine physician, I get to see them when they come in chaos, when they come in their worst moments. And having this facility with everything I need to take care of a child in crisis is a blessing to those families. Having this network across our community to get them the expert care that they need, having an integrated team of specialists who have given their lives to the care of children, saying to a mom, I know right now you're scared, I know right now you want to be anywhere but here, but you brought your child to the right place, and we're going to make sure he or she gets the care that they need.
And Dr. Chambers, when we talked about the investment that's being made to some of these rural areas out there, the construction that's going to happen at places like Indian Path, the construction here, $60 million investment, and you were telling me your background, you see and you know how important it is to invest that money in the children where they're at as well.
Oh, absolutely. You know, when your child is sick or when you've just had a baby, even if it's a happy event, you need your family, you need support. Some of our families depend on both parents' income, and so having to go out of the region is crippling for them. Some of our families depend on their extended grandparents, aunts, and uncles to keep the household running, and when you're removed from that, you don't have your support. And then people's churches are so important to them here. And so being able to take the care when we can right to those communities while still having this home base here of Niswonger, where if you need that expert care, we can give it, is so vital, and I'm so thrilled to see us spreading high-quality care across the region.
I was going to mention that because the word world-class care was mentioned up there
Yes.
several times. That you are providing world-class care here.
And what I would say about that is all of it is because first of the vision and the mission of
Right.
Niswonger Children's, but also the caliber of people who work here.
Right.
From the nurses who I've worked with in the ER or met on the floor, my nursing colleagues, the other physicians that work here, these are people who choose to serve here because they believe in the mission. They believe that every child deserves a healthy start, and so they've come to the Appalachian Highlands for that reason. And it is inspiring and fun. This is an incredible group of doctors and nurses, the support staff. I've only been here 8 months, and I can say that I didn't think I'd find another work family, but here I am. They're incredible people to work with.
And you just feel the passion
I was
when you
gonna
walk in the
say.
door. You really can.
They would do anything for these children, and it makes me feel very grateful to be part of such an amazing place.
Well, we are grateful that you
Yes.
are here. Welcome, your
Welcome.
first year.
It's nice to meet you both.
Yes, thank you. And thank you for what you are doing. And don't forget, this is about raising money for this incredible place that we have here at the Niswonger Children's Hospital. We've got a big hour of television ahead.